Thank you very much. My name is Professor Allan. I'm the Executive Director for Kenya Youth Consortium, commonly known as KANCO. We are hosting this delegation in collaboration with the UK, Resource UK. Both Resource UK and KANCO are members of the Action Global Team. We have 15 members ranging from UK, Canada, USA, France, India, Japan, Australia, South Africa, Cote d'Ivoire, Kenya, and Zambia, and finally Tanzania. What we do every Tuesday, we review global health issues and where opportunities are, especially when it comes to the global health institutions, including multilateral institutions, that is mainly the World Bank, the big bilaterals, and other institutions like Global Fund, including other big organizations or foundations. Over a period of years, we know that technology and experiences have spanned across, and we have done a lot of good work looking at those days of HIV, AIDS 101, and finally those days where we were looking at issues of TB and malaria, nutrition, and all that. Other than just pushing for or advocating for money at the global level, we realize that when we have the stories from the ground told at the decision-making tables, it have an impact. Second is that for us to be able to influence what must be done and why, we needed to have both government as well as that work together. The elected leaders play a major role in giving the direction in the best way possible. Remember, it's very difficult for a government to start at something very small, and therefore that needs to be tested. We get enough data for the government to take on, so that then we link it to the national strategy or the county strategy for that to receive money or funds from the national or county budgets. And therefore, when we bring delegates to a country, we allow them to go to the community, experience what it is to be there, live with them, eat with them, dance with them. And so that at the end of the day, when we are speaking from an experience. And therefore what we have done with the UK members of parliament now is to allow them to mingle, so to say, with the Kenyan communities, visit institutions, so that they can be able to experience the warmth of Kenya first. Second, what is being done, what are the issues, and how they are being addressed, especially the issues regarding to health. During this visit, we were able to have, the first brief we had is to go to the British High Commission, where we got a brief about what the UK government is doing well in Kenya, or the nation is doing in Kenya. After that, then we had another brief with civil society, and again, people are able to have good experience on what is going on, what is their feelings, what is their opinions, and all that. Then we also visited the government office. We were able to visit the team that coordinates TB in Kenya, where we generally talked about what is the government's response and how is that being managed and taken forward. What are some of the goodies or the things that have done very well? What are some of the charities that needs to be reviewed at? Then we were able to visit one of the sites in Nairobi County, where again we met with the leadership, the county government in terms of health, and where we were also able to visit Irish Health Development site, again to experience what does it mean to have children being supported, what does it mean as a parent at that level, what does it mean to engage with that community. Like I said earlier on, this is one of the sites that some of the experiences the communities have had have gone viral, so to say, that one of the experiences that we are soon going to have it sprayed during the fundraiser with some of the international flights of fundraising. Then we later went to Ragi'S County, where we met the teams that manage health in one of the health centers, okay, sub-district hospital, where the head of the team, the hospital superintendent, took through the team together with the CC Health, Ragi'S and communities. And again, we went through what called the global financing facility can do, especially looking at maternal child health and young people facility, where basically again we were able to experience not only being told but be able to visit the center, being taken around, see what it is. What was amazing is, and including them, they came up and said the kangaroo way of managing premature children, it's new. It's like an innovation. And so other than putting people in incubators where you have the child with the mother, provide the national warmth, and allow the child to gain weight for it. That has been one of the highlights that we found in that hospital. That global financing facility is able to unlock local resources. It attracts more resources, because when you improve maternity, then you improve the other support systems in terms of care for the mothers and the child. And also looking at how does that system work and how can we make it better in the future. And also talking at the county government link, see how the things work between the county government and also the national government. Again, after that, this morning we spent quite a bit of 3/4 of the day actually in Parliament. In the morning we met the health committee of Parliament, chaired by Dr. Bukose and assisted by the assistant is from MP from Karakamidi. We had an extremely good exchange between the members, and we were able also to identify some of the new areas that we may need to refocus on. For example, when we are looking at data and all these volumes of papers, is how to use e-health as a way of improving communication and data. We are also looking at how can we improve the uptake of services with the resources available. We are aware that Kenya is now going towards from a low-income country to a lower middle-income country. How do we retain the gains that we have already gotten? You may know that we have good program in terms of the institutions that have actually been able to be created, what we call the health systems, kind health systems, and therefore looking at how do we move to that area without losing. And some of the things is how do you move from bilaterals to plan within a multilateral space that is there. During the meeting, we also met the TB caucus led by Honorable Stephen Mure, mainly looking at the benefits we have realized on TB and what those institutional arrangements have made, both from creating a TB caucus for Kenya, for Africa, and the world, and how do we move forward to the UN high-level meeting in New York later in the year. Then later on, we were hosted by the speaker, so we go to the speakers gallery, and the honorable members were recognized by the speakers, including presence as KANCO, and also the support team from Resource UK. So, and we just are finalized in terms of giving a final brief, and therefore the team goes back tomorrow. The take home is, what is it are they able to demonstrate or speak about when they go home in the UK, and what is it we can also be able to do. I think for me, from a Parliament point of view, is they have been able to create that linkage between them and the Health Committee and opportunities to work together. We have also been able to link between them and civil society, where we have an extremely good relationship. And on the other side, we have actually created a scenario where we can almost say this is what is happening in the country, this is what is possible, what are gaps are available, and how can we together strengthen the partnership, both at the county level, the national level, between members of parliament, civil society, and the country, the two countries together, and graduate to the global world.
What gains has Kenya made as a country in the health sector, and how has funding contributed to these gains?
I think one thing that we need to do, some of the things that we have received as a country, is funds from Global Fund, which have helped us stem all the infections, most of the infections for HIV. We have also gotten this money to work on malaria. We have gotten money to work on TB. And that have actually been able to look at what, to stem down the levels of infection. Second is we have been able to create institutions. Remember, during COVID, stepped up the testing. Those testing facilities have been put together because of TB and HIV. And therefore, we did not need to import new technologies. The discussions with various members of parliament to raise issues of drug abuse to mother-to-child infections to many other. That helps us to actually bring the menu so that we can actually look at it and how best to do it. The second thing is the fact that we have parliament recognizing this thing just shows you that it's not just another visit, but a major bilateral relationship opportunity where we can now relate back to some of the benefits we have ever had.
And in terms of policy formulation, what gaps exist that need to be filled in order to improve the health sector in Kenya?
I think some of the things that we are looking at is how do we further engage to ensure that then the resources at the national level and the county level are managed for the benefit of all. And that means better planning and better use of data. So that we have a county that have challenges in terms of TB, how to address it. And we have counties where we have like malaria, how do we manage it? If we have issues like where we don't have enough nurses and how do we improve in terms of community health frontiers or promote or help whatever it has been referred to as community health promoters.